I'm going to discuss about a very interesting topic, that is how early experiences can influence the adult uncertainty. Who doesn't want to feel good? We all want to feel good. We all want to be respected from others, isn't it? So these are the experiences that we all like. So we also know that our human brain is very complex. It's not a very simple calculation like 1 plus 1 is equal to 2. So human brain is influenced by many factors like biological, psychological and social influences. So coming to young adults like you and adolescents, there is a lot of intense brain development happening for you. I don't know how many of you know how intense these activities are, but I want to throw some light on what happens, with your brain at this age. So behind this forehead, we have something called as the prefrontal cortex. So we all don't know, most of us, that this prefrontal cortex is in still a maturation phase, still the mid-20s. It keeps on maturing. So if your parent comes and asks you to behave in a certain way, obviously you wouldn't, because your prefrontal cortex, which is responsible for planning, execution, for decision making, impulse control, all of this is still in the maturation phase. So obviously we cannot expect you to understand so much. But at the same time, there is this emotional center in the brain, which is called as the limbic system. You must have heard about it. So this limbic system is in a very intense, active phase during this time period. So that's the reason we see young adults react and respond in a very emotional way. So we see that you resort to substance abuse, many risk-taking behaviors, rash driving. We do see all of this. So there is a conflict, going on between this emotional center and the cognitive, the prefrontal cortex. So that keeps on this conflict, trying to resolve this conflict, your whole youth goes on. So let us try to understand, how these develop, and I'll also share some of my experiences with some of my patients, how these kind of help them. So also neuroplasticity. You must have heard about what neuroplasticity is. What is neuroplasticity? When children, adolescents and young adults, they have this high neuroplasticity. That is the ability to reorganize and adapt to a stressful situation, which is high. Post 40, 50s and 60s, I think they lack a little bit of that. So how do we utilize, this neuroplastic phase? For example, you have a small plant, growing on a very, it is in a windy environment. It learns to bend, it learns to come up. So it grows into a big tree. It can withstand storms. But let us say when it is in the, small plant phase, it is experienced a big storm, then obviously its shape distorts, it might break off, it might wither. So similarly for children and adolescents also, the kind of experiences that we have as children, it could be any kind of abuse. It could be a verbal abuse by your teacher, by your friend. It could be a physical abuse by someone. It could be a sexual abuse that people don't talk about. So these are all bad experiences which can change the way the person feels, thinks and behaves. I had this 19-year-old boy, coming to my clinic with sudden, his socially he started avoiding people. His academic performance came down. He was from a good family. Till then he was all fine. And then he was so depressed, anxious. He was also very irritable. He wasn't opening up in the initial few sessions. Then slowly when we probed onto, he started saying that he was a victim of bullying. Bullying, though it is a very, looks like, just a simple teasing someone or something, but it can cause many adverse effects. So this boy was bullied for the complexion of his skin, for the pimples he had, for how he looked, his physical appearance. So then he started feeling very sad and very low. So what happens with this boy's brain? Let me explain. So there is something called as a hypothalamo-pituitary axis for us. So this hypothalamo-pituitary axis is something which regulates our response for stress. So when it is activated once, the cortisol levels are raised so that we are ready to face stress. But what about if it is repeatedly activated? Like repeatedly someone keeps bullying you, teases you, call you names. Then this repeated activation causes that person to become very hypersensitive to stress. So this boy became very hypersensitive. He became very anxious. And then there is another part of the brain called as amygdala, which is responsible for the fear process. So what this boy felt, that fear of someone, calling him names, so he started interpreting this to every situation he's facing. So every situation, this amygdala is getting activated and he's getting fear. So he started to avoid social situations altogether. Social avoidance. Many of us might have experienced, avoiding social situations because of anxiety. And then why his academic performance came down? Okay, he has avoided social situations, he has got very stressed up, but why his performance got affected? So we all know what is the center of learning and memory? Hippocampus. So whenever cortisol levels are raised too much, studies say that hippocampus shrinks. So when this shrinks, there is problems with attention, concentration, retention of memory. So this boy's academic performance came down. So there is treatment for this. I have treated this boy, putting him on a medication, referring him for psychotherapy sessions. There are new techniques called neuromodulation, depression, anxiety, everything can be treated now. But could this have been prevented? Could this have been prevented? Yes, it could have. It could have with proper awareness in schools and colleges about mental health issues, what a student might be facing. It could have been prevented if a parent would have talked to the child about, the communication channel is open and talks about what's happening, in your day-to-day life. And it could have been prevented if the child would have spoken out about it. So there is a Telugu proverb, Adagande Ammaina Annam Pettunda. So you have to talk about, you have to voice your opinions. You have to talk about how bad you're feeling, your experiences. So unless you talk about, no one would care. Why would they care? So finally you'll land up with a mental health professional. So please talk about your bad experiences, if any, with your friend, with your colleague, with your teacher or a parent, whoever you are comfortable with. So that we can prevent, this series of changes in your brain which is happening. We can help you out. So neuroplasticity is something that you have to use it very effectively. The more you use it, some neural networks will get strengthened. So the policy of use it or lose it. Like you study regularly, you practice a musical instrument regularly. We have seen this tabla performance. So it comes with a lot of practice. So then the neural networks get strengthened. You'll be able to, the memory will be retained more often. But let us say you're not studying, you're not developing social networks, you're not talking with people. You'll lose that ability eventually. Then there's again a, downfall, a series of low self-esteem, not feeling good, and all of this. So it's very important that your skills have to be put to use regularly. That's very, very important. And you will have to voice out your opinions regularly about the experiences you face, because any good experience is going to have a good effect on our body, in our brain, and any bad experiences will cause all of these changes in the brain. And the young adulthood is a good time to utilize it very effectively. So what I feel is we have to invest our time also emotionally and financially in raising awareness about mental health, especially in young adults. That is how we can create a healthy atmosphere, and the society will be good. And let us say, see, if I want to be respected, I also should give respect to others, isn't it? So I would request all of you to share a good word to your friend every day, now and then. Keep asking, people how you're feeling. Is there any problem? So a kind word would make your friend's day. So please, talk about issues, and so let us create enriching experiences for all of us. Thank you.